NDTV 24/7.
Hello and welcome back to your daily dose of Dr. NDTV, a health show where we answer your questions on various topics. Today on the show we discuss tennis elbow, and the guests with us, so we have in Bombay we have Dr. Sanjay Desai, who's an orthopedic surgeon and a specialist in sports injuries at the Breach Candy, Jaslok and Bhatia Hospital in Mumbai. And right here in the Delhi studio we have Dr. Shekhar Agarwal, who is the director of the Delhi Institute of Trauma and Orthopedics at the Sant Parmanand Hospital in New Delhi. So if you have any questions, you can call us at 011-516-33300 or log on to drndtv.com. You can also SMS your questions to us at 6388 and we'll answer them. Thank you both for joining us. Let's first begin with you, Dr. Agarwal. What exactly do you mean by the term tennis elbow?
Tennis elbow is a condition in which patients usually complain of pain on the outer side of their elbow. It is usually on trying to lift an object or trying to move it repeatedly, and it is not accompanied by any pins or needles or any numbness in the arm. So because it was initially described in tennis players, it is called tennis elbow, but by and large we see more often in household women and other people than in tennis players themselves.
So the cause for it is basically the wrong usage of the arm, is that right? Or it could just happen to anyone?
It's very difficult to use the term wrong usage of the arm. You know, everybody wants to use their limbs in the right way. But it is repetitive movement of the same kind, because basically inflammation occurs at the point of origin of all the muscles that take origin from the point of the elbow. And they go and supply to the wrist and the hand. So any movement in which there is repetitive movement, there is constant pull and push of the origin of these muscles at the point of the elbow. And once these muscles get inflamed, then patients start to complain of pain around the elbow, and that is called tennis elbow.
So you're saying that it's not only people who are into playing various sports, especially tennis, it's also the women in the house who do use their arm for long periods of time?
Yes, repetitive movement like washing or churning for food or making halwa or something like that, yes, they get tennis elbow.
Those are the ones which will cause the most problem. Also, can this condition be treated completely?
Most people do settle down over a period of time, but it is very, very difficult to assign a particular mode of treatment what is going to work, and one can definitely say that, okay, this modality of treatment will definitely work and one can get cured. Some people do get recurrences. They come from time to time. Only yesterday I had a lady for 1 year, she's not been cured. So though in case of Sachin Tendulkar, that's what the hype is about on tennis elbow, suddenly. Claims are being made that he'll be cured in 3 weeks' time. So I don't think one can make guarantees on any modality of treatment, though there are many methods of treating it.
Okay, we'll come to the methods later. What are the typical symptoms of the situation? Is it only that the arm hurts a little bit and that's how a person realizes there's something wrong?
No, the arm hurts at the point of the elbow particularly, especially when one is trying to lift anything, even a cup of coffee. And then the arm begins to hurt. And the pain can radiate up and down the arm. But as I said before, there is no numbness accompanied with it. One does have to consider other conditions that can mimic the same thing, like pain arising from the neck in cases of cervical spondylitis can also mimic the same thing, or a nerve can get trapped just around the elbow, that can mimic the same thing, or some patients have arthritis of the elbow joint also. So if you can't find any other cause for pain, you have done x-rays, in some situations even an MRI, and you don't find any particular cause, then you do assign it to tennis elbow.
Okay, we also have with us our Bombay guest, Dr. Desai. In fact, if you can be a part of this discussion now. We've been talking a little bit about the treatment, and Dr. Agarwal here said that there are various modalities of treatment that are available. What is the first option always for a medical expert, a doctor would do for a tennis elbow?
Well, I think the first choice of treatment should always be